Wound from the rifle weapon. It is very important for us how much type of how many types of wounds are being caused. Contact wound means the barrel is within the contact of the tissue, means complete in contact like this. Close range, slight distance from the tissue. Intermediate, lot more distance. Medium range, another more distance. Extreme range, lot more distance. So distance increases and the nature of the wound also increases. So nature of the wound also varies. Contact wound have different features. Close range wound have different features. Intermediate or short range wound have different features. Medium range may have different feature. Extreme wounds may cause a lot different picture. So contact wound, tight contact wound, which is means the barrel is being in the contact, completely contact and pressed against the tissue. Then the muzzle imprint is there. You can see the muzzle imprint is there. Then we have a split or cruciate laceration. Laceration is there. Local reddening or carbon monoxide, there is a reddening, CO. Then we have bruising also. Some bruising may be present here. You can see the bruising redness present here. Detached periosteum. We can see the periosteum being torn out. A little or no external propellant or swelling. Sometimes here it is swelling present, but sometimes with little or no external propellant, external injury, external or sidewise injuries are present. This is the pictorial diagram. If a bullet is being fired within the contact of the tissue and the bone, fire contact discharge contains tissue overlying bones such as skull causes gas to rebound. The gas is being pushed inside the tissue and it rebounds. Pushed and it rebounds. It rebounds and makes a dome. Dome is here and that dome leads to the split of the tissue and gas is released. That can split and gives ragged entrance. So entrance can be something like this, not circular, because of this explosive mechanism, and the bullet can go penetrating the skull and the other part of the body. Contact wound, where the contact over the soft tissue like abdomen or any other places where there is a chances that there is no underlying bone. Possible muzzle imprint, circular hole with the abrasion collar. Abrasion collar is there, circular hole. Bruising can be found. Powder cavity, you can see the powder cavity. Local reddening, carbon monoxide. No external or propellant swelling, very little propellant swelling is here. Swelling or tattooing, you can say very little, whereas most of the things go inside. Flames, other things go inside the body, don't come out because of the ballooning or the dome formation. Back spatter, when something is very close, gun is very close. Contact wound, the also close range discharge may cause blood and tissue fragment to enter the muzzle, sometimes penetrating the several centimeter. This is being called back spatter. This is because of the suction mechanism or negative pressure that is being created inside the barrel after the quick discharge of the gases. They appear to be a momentary suction effect after the pressure of the gas blast subside, possibly as a result of rapid relative cooling. The barrel is being hot initially and it cools. So the gas first come out, then there is a cooling and there is a negative pressure, then it sucks. If suddenly there is a tissue, it can be sucked here. That is called back spatter. This seems to be aspirate material into the muscle pieces of the skin. Hair and adipose tissue have been found inside the weapon. Whereas sometimes blood and tissue may soil the hand of the arm if the weapon is very small. So sometimes the blood and all that can be sucked back and the blood can be found on the assailant or the whoever is discharging the weapon. So it is of forensic importance where we can say that an accused can be traced by the spatter on the from the gun. Muzzle imprint. There may be a muzzle impression on the tight contact wound. We have seen here. Impression or the imprint result when the skin is slapped with the muzzle due to rapid extensive expansion of the gases within the tissues. Again, we have formation of dome, and from there the skin is pushed to the muzzle, and that pushing can lead to muzzle impression. Here it is the muzzle, then it is the wound, then it is the muzzle impression. Close range wounds we can find in different close range, slightly gap between the tissue, between the body or the tissue and the gun. Entrance bullet wounds are characterized as close range when the muzzle to target distance are such that target surface is still within the range of flames. Means that there is when the flame which are coming out of the barrel, they can also affect the tissue. Still muzzle blast, it is usually 1 to 2 inch in case of handguns. 1 to 2 inch means this much. 1 inch to 2 inch, it is a distance. So if the flames can also travel and they can cause certain injuries like burning or hair singeing, soot or smoke soiling, blackening, powder tattooing and fouling. We can describe everything in the coming slides. Skin burning and hair singeing. Surface hair, if present, may be either completely removed or burned. Here we can say we have got a close range where all the soot particles and the flames have burned the clothes, and the soot particles, tattooing and soot particles are deposited on the clothes. Fouling refers to a tiny lesion around the entry wound caused by metal fragment. Fouling means if a certain metal fragment of the jacket or the bullet has just a little bit broke and they get deposited in the wound. Intermediate or short range, it nearly about 30 centimeter, 12 inch to. This term may be applied when the victim is within the range of powder deposition but outside the range of flame or muzzle blast. So powder can be deposited. Tattooing can be present. Powder tattooing, there also occur blackening of the skin of the material around the entrance site from soot produced by the combustion of the propellant. The size and density of the area of the powder tattooing vary with the caliber of the weapon. Means the caliber of the weapon, how much barrel or size is, how much width is, how much the gunpowder is there, type of propellant, how much different type of amount of propellant is used. So this tattooing and the blackening can be used to calculate something, which is which type of weapon may have been used. As the distance increases, the intensity of powder blackening and tattooing decreases. The size of the soot or the powder pattern increases. the virtually all handgun cartridges shoot is absent beyond 12 inch. After 12 inch, they are generally absent. Shoot can be easily wiped away by copious hemorrhage or by intentional wiping, but powder tattooing cannot. If powder is there, powder has traveled, then it is very hot and it gets deposited in the tissue and can lead to inflammation. Soot can be wiped out, which is a blackish powder, very fine powder, and can be wiped out. But the powder tattooing, which is somehow very coarse in nature, it can travel, and if it strikes the tissue, it get embedded and cause injuries, minor injuries, and can get inflammations around it. So it can be very much, we can say that it is an antemortem phenomena. Reddish brown appearance is here, and orange red punctate lesions surrounding the wound or the entrance. This is distribution around the anti-site may be either symmetrical or eccentric. Suppose it is a wound, it can be, powders can be deposited like this, or it can be deposited like this, depending upon the angle of the firearm fired. If it is at 90 degree or something tangential, then we can get it. If it is somewhat acute or other angles, then we can get this shape. So from the deposition of the powder, we can say that we can determine the direction of the wound and direction of the firing, and we can also say about if there is a reddening and other inflammatory feature, then we can also say that it is a phenomena of antemortem gunshot. Powder tattooing is the antemortem phenomena, indication that the individual was alive at the time of discharge of the weapon. So this is the wound, and you can see there is a little bit tattooing is there. Medium range 5 to 6 feet, there is nothing to indicate increasing range. Consequently, appear the wound inflicted with a distance of 5 to 50 feet, but there is no entrance wound. As such, range is usually circular or oval, and the margins are driven inward by the passage of the missiles. Margins are generally towards inward, and the size of the hole rarely equal to the size of the diameter, because when the bullet strikes, it makes the gap in the tissue. Bullet goes, the fibers and the contracting material of the tissue, it decreases the diameter. So we can say that the size of the hole is rarely equal to the size of diameter of the missile, and therefore caliber of the weapon cannot be determined right from the inspection of the wound. Reason is because of the recoiling or retraction of the tissue. After the bullet passes the skin tend to return to the former size. As I already told you, edges and the wound contract, resulting into the formation is smaller than the diameter of the missile or the bullet. Abrasion color in medium or range or medium range wound, we have other features, that is abrasion color. Since the bullet is hot, which is fired from a expansive materials which lead to fire, and that lead to the heating of the bullet also. So when it strikes, it can burn the tissue close all there, and it can also cause injury and penetrates, but it can lead abrasion there or slight bruising also there by entering in that. We can describe that as a abrasion color. Then we have another collar also, we will see. Immediate around the central aperture shows abrasion, even bruising. Abrasion is there and bruising is there. Proof of entrance wound. This is the proof of entrance wound, because here we have something, interaction is there. Bullet coming to the tissue with a certain amount of velocity, and it interacts here and tries to go inside. So it will cause injury, and that injury will have abrasion, bruise and stab. Actually, all the gunshot injuries, especially of rifles, are, we can say it is a stab wound, because a somewhat solid or somewhat bullet is penetrating into the tissue, that is stabbing into it. If the weapon has been discharged perpendicular to the body surface, the abrasion ring is circular or uniform. Circular or uniform, you can have. Weapon have been discharged perpendicular, then the circular and uniform. If it is discharged from the side obliquely, then it can be of different shape, elliptical, and we can have collar as accordingly. So it is very clear, when the flames and the soot particle range subsides, then there are chances that we have abrasion or the other particles, abrasion or the bruise collar which is there. And before that also, within the range also, flame also, there are also abrasion, but they are more predominated by tattooing and the swelling. Tattooing and the initially the soot particles. Grease or dirt collar. The barrels which are being used, or the guns which are used, will have grease applied on inside the barrel. So the bullet always carried some of the grease with it, and along with the abrasion collar, it also deposited that grease. Then that is called grease or dirt collar. In addition to abrasion, a coating the foreign material may be found around the margins of the wound. Due to removal of substance from the bullet, it passes through the skin, bullet lubricants, gun oil or interior of the bullet. Bullet lubricants, gun oil from the interior of the barrel, barrel debris, dirt carried to the surface of the bullet. It travels through the atmosphere, and from the atmosphere it can gather the dust, and the ring is present into interwoven. It is interwoven with the abrasion. With a jacketed bullet, hard metal, the swelling is less common. The ring is not usually appreciable as a gross inspection. Means generally the grease or the dirt collar is mixed with the abrasion or the bruise collar. So we have to examine it in the laboratory. This is the angling or the missile perpendicular to the body, which is perpendicular. So it is a circular wound. It is at angle. Then we have elliptical wound. Collars. Abrasion collar is there. We have a diagram here. Blackening, tattooing, abrasion collar, or grease collar or entry wound. But it may be, this can be merged here, because you cannot find very clear here. Extreme range, more distance traveled by the bullet remain steady. Only minor variation from the axial stability. If a bullet is going like this, it will go after some long distance. It can go like this, or it can go like this, and it's still traveling in the. It can go like this. It can further go trembling after certain distance. So we can, after certain distance, about we can say different depending upon the weapon, then it can deviate from the path, or bullet can just move around the axis, and it can penetrate the tissue. When the extreme range is achieved, the reduced velocity may result in the instability of the flight path. Bullet may begin to wobble or yaw. Wobble means it may go this, or yaw means it may go this direction. So, if the bullet strikes the body during the phase, the impact may be sideways or even backward. It means if a bullet is like this, suppose a bullet is like this, it is going. After some distance, it has lost its velocity, then the bullet can be moved like this. Then this part can strike, or a bullet can move like this. So this part can strike the tissue. So entry wound can be of different from the which we are expecting from this part. The wound accordingly will be irregular or may present difficulty in differentiation from laceration or other means. So we can have difficulty in analyzing the wound, but it is not much difficult. We will see to it. This is the diagram. If a gun is fired from a distance, then different things stops at different level. You can see here dirt ring in the very close, then we have abraded, then we have soothe, then we have tattooing. Exit wound, it is a very common accepted phenomena. It is generally larger than the entry wound. So we will be describing how it is large. The bullet passes through the body, exit wound, and sometimes it is called outshoot wound. Exit wound commonly presents larger and more ragged appearance than the corresponding entrance wound. Though exceptions are numerous, we are not going into the exceptions. Outshoot particles or exit wound may be varying depending upon the tissue. It can be slit-like, stellate-like, cruciate-like, or irregular or gapping. Deformation of bullet during its passage. Various characteristics that are being achieved are because of the changes that have happened to the bullet during its path. Deformation of the bullet during the passage. Tumbling of the bullet, it means it has just taken around here, it is tumbled. Breaking of the bullet may break into the paths. We will see to it. Bullet on leaving the body on further side tend to produce a everted wound, and there may be enlargement and tearing of the margin due to disturbance of the steady gyroscopic path of the bullet. Suppose if we have this, the bullet is coming and is trying to come out. Now the skin is being pulled up and a tear is being made. So two phenomena is working. One is bullet is revolving around its axis and it is moving forward. So revolving and moving forward action can create upward or everted margin and a larger gap. This is the everted margins. You can see everted and the larger gap. It is a laboratory tissue. We can see the bruising and all that, or you can say there is a other depositions which are from it. It is a very long preserved tissue. Entry and exit wound, it is very already I have described, but the summary: wound, entry wound is usually small, exit wound is usually big. Edges are usually inverted in entry wound, whereas edges are usually everted. Abrasion color, abrasion contusion are present in entry wound, abrasion color, abrasion contusion absent. Burning, singeing, blackening and tattooing may be present in entry wound. These things absent in the exit wound. Grease or dirt color present here but not present there. In contact at close range wound, the track near the early entry wound may be bright pink because of the carbon monoxide poisoning, but carbon monoxide interaction with the hemoglobin. So not here in the exit wound. Clotting may be turned in and shreds carried with the wound to varying distance. Clothing may be turned out, but it is a variable phenomena depending upon the wound. Clothes may be torn out and clothes may be torn in entry wound and torn out in exit wound. Unusual phenomena are there. There are various unusual phenomena of the bullet. We can say that, and we can get in the day-to-day practice. Tail wag or tail wobble. As such close range before the bullet settles down, steady gyroscopic progression. The tip of the bullet may follow the axis of the trajectory, but the tail of the bullet may describe its circular or spiral amount on the line of flight. If the bullet strikes the body during this phase, that is during the first few microseconds, after the tearing the muzzle, the entrance wound may be larger than the exit wound. A margin may even be everted. This is the we can say that very initial phenomena, tail wig. It strikes the bone and moves like this the bullet. Then the entry wound will be bigger. Large, irregular and jagged inlet bullet may also be seen in extreme range where steady gyroscopic bullet is being lost. Again there it is lost and bullet has turned like this and striking on the other sides. It can cause a irregular wound. These are very extreme phenomena, but we have very common phenomena, that is ricocheting of bullet. Means during the trajectory, bullet strikes to some surface and changes its course. Suppose it is striking this and it changes its course. It is striking this and this changes. Suppose this is a bone, it strikes and changes its course. It may come in this direction. It may go in another direction. It depending upon the surface it strikes and its hardness and its angulation. Ricochet bullet is one that gets deflected or deviated from the course by striking or an intervening object in its way before striking the body. Sometimes a bullet is fired in the air or somewhere else, it strikes a pillar and goes into and hits somebody else. That is another phenomena. It may even ricochet inside the body. It can ricochet inside the body by striking with the bone. If suppose a bullet is fired in the chest cavity, it is ricochets with the ribs and goes somewhere else. We will be seeing in the examples also. This deflecting of the bullet on encountering slight obstacles have been ascribed partly to the obliquity in which it strikes and partly the rotation motion already in the bullet. This is the ricocheting. It is going and the intervening object is there and it strikes and comes back to the target. This is phenomena that is called billiard ball ricochet phenomena. It is generally happens in the cranial cavity. We have seen many cases in cranial cavity. The bullet is being fired from here and it should be lying here, but it is lying back here. So it is just different angles of the skull. It can move and it can be lying anywhere within the cavity. So we should get an X-ray done before the opening of the cranial cavity. If it is strikes here, it can come here. It is strikes here, it can strike here, it can go there. it can strike, and from here it can follow the whole circle and come here also, or come here also, depending upon the angle. It can strike anywhere. We have seen cases in which the bullet has struck here and it has gone all the way, and it has come the way out. But we are not going to the extreme of that. But we get very much ricocheting in the skull. Single entrance and multiple exit wound, it is definitely the fragmentation of the bullet that can lead to multiple exit wounds, but single entry wound because of the fragmentation of the bullet, because striking the bones and all that. Multiple wounds of entrance and exit from a single shot. It is again, there is a person is running, or a person is having position like this. A bullet is striking here, it exited here, it has struck in the chest and is struck out. So it can, single bullet can cause one entry, one exit, one entry, one exit, 4 wounds. So if the person is moving, then the chances that same bullet can cause multiple injuries. So we should not be confused with that. We should try to inquire into it. Entrance wound present, bullet absent. This is the phenomena. Sometimes bullet enters the stomach but may be vomited out. The bullet entering the gastrointestinal tract may be passed into the feces. So various examples are there. Tandem or piggy bullet. When the first bullet is lodged into the barrel and the second bullet is fired, both come out at the same time and can present in the same wound. Souvenir bullet. Souvenir bullet is another thing. A bullet is being fired and it is not found, or it is there but it can't be taken out, and it is there inside the body and it is doing no harm. Sometime a very remote case of lead toxicity can happen because of the bullet present there. It depends upon the vascularity of the tissue where it is being lodged. Thanks very much for today's patience. It is being a long lecture. We will be attaching a video how the air guns, how the pistols are being fired and how it works. And in the coming lecture, we will dealing with the post-mortem analysis of the wound and the blast injuries. And we will be further continuing on the other forms of injuries in our coming lectures. Thank you very much for today.